Good day everyone, I am Julina Divilla, a student nurse from Medici de Makati College. I will perform the assessment of the newborn at birth procedure. But first, we have to assemble all the necessary equipments. And before I verify my newborn's identity, I will perform hand hygiene and wear PPE as needed. Then I will provide privacy for my patient. And now I will start to verify my newborn's identity by looking at the crib tag and ID band. Now I will check the newborn's vital signs by getting the axillary temperature, inspecting and auscultating the lung sounds, respiratory rate, and the apical pulse, and we will also get the blood pressure of the patient. But we can only get the blood pressure of the baby by using the Doppler stethoscope. And now I will be completing the general survey by getting the length, head circumference, chest circumference, weight, abdomen, obvious deformities by using tape measure and the weighing scale. Now, I will assess the newborn by getting the Apgar score by 1 minute and 5 minutes. But since we already have the heart rate, respiratory rate, we will now just check for the muscle tone, reflex irritability, color, and of course, we will get the final score of the baby. The gestational age of the baby is 42 weeks and delivered normal. Now, I'll be inspecting the appearance of a newborn. We will start with the skin. I will inspect the newborn skin includes color, any birthmarks, vernix caseosa, lanugo, desquamation, milia, erythema, toxicum, forceps marks, lesions, and skin turgor. I will also inspect for the hair and nails. Now, I'll be inspecting the head of the baby if there is any abnormalities or deformities. And after that, I will inspect the newborn's eye, external ocular sutures, and internal ocular structures by using the pen light. Next is inspect the newborn's external ear, skin condition, and skin tag, and we can also inspect the internal ear by using the otoscope. Now we have to inspect the appearance of the nose and test for choanal atresia and of course the internal part of the nose by using the pen light and note for any distress with breathing. Now we have to inspect mouth and throat of the baby and note the condition of the lips, palates, and tongue. And now we have to inspect the newborn's neck, which appears short with crisp skin folds. And the head should rotate freely on it, and of course we have to check the resistance of the newborn's neck by supporting the head of the baby while in sitting position. Now we have to inspect the chest of the baby by getting the chest measurement and symmetry of the both right and left side of the chest, clavicles, and nipples, and observe also the respiration rate of the baby. Now let's proceed to the abdomen. We have to auscultate the bowel sounds, inspect the contour, palpate the liver, palpate the spleen, and inspect for the umbilical cord. And of course, we have to check the kidney and verify if the kidney is working, checking the diaper if the baby has voided. And of course, stroke each quadrant of the abdomen with a finger and would cause the umbilicus to move. Now, I have to inspect the female genitalia of my baby. And now, I will start it by insert gently the tip of the lubricated finger to the anus to check the meconium of the baby. And after that, I'm going to perform hand hygiene before touching the female genitalia of my patient. Now, I will inspect the vulva which may appear swollen and inspect for vaginal secretions. Now, I'll be inspecting the back of the baby by inspecting the spine which is typically appears flat in the lumbar area and sacral area. And I will also inspect the base of the newborn spine. And now, I will be proceeding with the extremities. Starting with the arms, hands, fingernails, muscle tone, hand side, palm, fingers. And later on, you will also see me observe the movements of the legs and arms that must move symmetrically. And of course, I will also test the baby's movement in terms of the lower extremities and its appearance. Inspecting the extremities of the baby is a very long procedure, but I want you to watch it clearly as I do the procedures. Then after the assessment, report the significant findings about the Apgar scoring of the baby. And now discard your PPE and perform hand hygiene. So this is how Apgar scoring system looks like. Each points define the abnormalities or the findings about the baby, such as in their activity or muscle tone, pulse, grimace, appearance, and respiration. And with the assessment that we conduct earlier, the total point is 10, which is excellent.